So one thing that we want to do as part of this consortium, so we are building a consortium called the REACH Consortium. It's based on the region and ethnic variations in Alzheimer's disease and cognitive health. So one of the aims of the consortium is not just to understand the variability across the US, but also to understand sort of the factors that are associated with these variabilities. So are there certain areas which are, say, physically more active people live, which essentially has lower risk for Alzheimer's disease? Or are there are there areas where there is, say, higher chronic health conditions like stroke or cardiovascular disease that's leading up to higher risk for Alzheimer's disease? Are there areas where there's more depression in that population that's resulting in more people being diagnosed with AD, or other nutritional and diet risk factors? So we're looking at a broad range of risk factors to see how these risk factors play a role in either areas having higher or lower prevalence. So if there are prevention programs that are aiming to sort of reduce Alzheimer's disease within these communities, they can focus on those factors in sort of helping people overcome those factors in a way. This way, potentially reducing the community level Alzheimer's disease risk. So for clinicians, what we would like to focus on is more on in terms of health disparities. I think that there are the disease burden in the minority populations, say Hispanics, African American, Native Americans, is going to be a lot higher because some of the areas that they live in are areas with lower socioeconomic status. So probably the prevention programs or public health programs that are centered around those areas and clinicians sort of working in those areas should be a little bit more cognizant of the disparities that are potentially there in terms of health. So in terms of health disparities. So our goal is sort of to provide this picture of what this condition looks like within the US, and people and clinicians within those areas being aware of how much they can expect to see these conditions in those areas, and maybe help people with better prevention strategies that is more specific to the area. So that's sort of where we hope to sort of make a contribution.